Ginger is celebrated all over the world for all of its health benefits. From soothing digestive issues to alleviating nausea, this root has been cherished for centuries. However, while it's often hailed for its therapeutic properties, there are circumstances where ginger should be avoided. In this video, we'll dive into the instances where ginger might not be the best fit for your health, helping you make informed choices about its consumption. Understanding these situations can ensure that you harness the best of ginger's benefits while safeguarding your well-being. Before we proceed, make sure to subscribe to our channel and hit the like button so you never miss out on our future videos. With that said, let's jump in and talk about the 9 occasions when to avoid ginger. Number 1, bleeding disorders. If you have a bleeding disorder, it's crucial to be cautious about your diet. Ginger is known to have blood-thinning properties, which could exacerbate bleeding in individuals with bleeding disorders. The active compounds in ginger, such as ginol and curcumin, possess antiplatelet and anticoagulant properties. These components can interfere with the body's natural clotting process, leading to prolonged bleeding and potentially worsening the condition in those with bleeding disorders. It's vital for individuals with such disorders to consult their healthcare providers before incorporating ginger into their diet. Number 2, diabetes. Ginger has been observed to potentially lower blood sugar levels. Although this may be beneficial for some, it can pose risks for people already managing their blood sugar levels due to diabetes. Sudden drops in blood sugar can lead to dizziness, weakness, and even fainting. Moreover, ginger's natural blood-thinning properties can be troublesome for diabetics who may already experience issues with blood clotting due to their condition. Excessive ginger consumption could further exacerbate this problem, leading to potential complications. Diabetics should consult healthcare professionals for personalized guidance. Number 3, gallbladder issues. When the gallbladder is not functioning optimally, it struggles to efficiently release bile, vital for digesting fats. Ginger, being a naturally spicy and pungent herb, can stimulate the production of bile in the gallbladder, potentially causing discomfort and worsening the condition. Ginger's strong blood-thinning properties could pose risks for those with gallbladder problems. Has any complications in this delicate organ can lead to bleeding and other serious health issues. Individuals with gallbladder issues should approach ginger consumption with caution and consult healthcare professionals for advice. Number 4, heart conditions. For those dealing with heart conditions, the use of ginger might pose certain risks. This is primarily due to its potential effects on blood circulation and blood pressure. Ginger has been known to possess properties that can stimulate blood flow and improve circulation, which could lead to an increase in heart rate. Ginger's natural blood-thinning properties can affect the blood's ability to clot, potentially causing complications for individuals with heart conditions who are already taking blood-thinning medications. Number 5, medication interactions. Individuals taking certain medications, especially those for blood clotting, high blood pressure, and diabetes, should be cautious. Ginger's natural properties can thin blood and lower blood pressure, potentially affecting how medications work. It could lead to unexpected results and health problems. People on medications for blood clotting need to be vigilant about their ginger intake, as consuming ginger alongside these medications might intensify the blood-thinning effects, resulting in an increased risk of bleeding. Number 6, being underweight. Ginger is often celebrated for its potential to aid digestion, reduce nausea, and alleviate inflammation. Nevertheless, its natural properties can inadvertently contribute to challenges for people striving to gain or maintain a healthy weight. Ginger's ability to stimulate the digestive system can increase the production of digestive enzymes, potentially leading to a faster metabolism. This may result in a decrease in nutrient absorption for those trying to maintain a healthy weight. People struggling with being underweight should consult healthcare professionals or nutritionists for dietary advice. Number 7. Pregnancy. Studies suggest that consuming high doses of ginger during pregnancy could potentially increase the risk of miscarriage. Therefore, it's advisable to err on the side of caution and moderate ginger intake, especially in the first trimester when the risk of miscarriage is comparatively higher. Ginger's ability to act as a blood thinner might affect the clotting process, posing concerns during childbirth or related procedures. This could potentially lead to increased bleeding, creating challenges during delivery or even postpartum. Pregnant women should consult with healthcare providers before including ginger in their diet during pregnancy. Number 8. Low blood pressure. The active components in ginger, such as gingerol and zarine, are responsible for its unique properties. These compounds act as vasodilators, widening blood vessels and causing a drop in blood pressure levels. For those already dealing with low blood pressure issues, the consumption of ginger can intensify these symptoms. Ginger's ability to stimulate the production of certain hormones and neurotransmitters can potentially contribute to a further decrease in blood pressure. This psychological response can have adverse effects, particularly for individuals prone to experiencing sudden drops in blood pressure. Number 9. Surgery. When preparing for a surgical procedure, you need to consider certain foods and supplements that might interfere with the body's response to anesthesia and other medications. Ginger may heighten the risk of excessive bleeding during surgery, potentially complicating the process and increasing the likelihood of post-operative complications. Moreover, ginger's natural ability to affect blood sugar levels could pose a challenge for individuals with diabetes, interfering with their regular insulin intake. This could cause fluctuations in blood glucose levels during the surgical procedure. Healthcare providers typically advise patients to refrain from consuming ginger at least 1 week before any scheduled surgical intervention to mitigate potential risks. To sum things up, ginger is a versatile and healthy spice with many benefits. People commonly use ginger for many types of nausea and vomiting. It's also used for menstrual cramps, osteoarthritis, diabetes, migraine headaches, and other conditions. But there is no good scientific evidence to support many of these uses. However, it's essential to be aware of situations where it's best to avoid ginger. If any of the issues mentioned apply to you, it's important to seek advice from a medical expert before adding ginger to your meals. Keeping a watchful eye when needed ensures you can relish the benefits of ginger without any concerns. Thank you for watching and subscribing to our channel. See you in the next video.